Ravi Naini, case on a papilledema in a young unveiling COVID-19 connections.
Good afternoon, everyone. I am Dr. Naini. Good morning, everyone. I am Dr. Naini here going to present about the papilledema in an unveiling COVID-19 connections. So there are no financial conceit and interest. So coming to the background, as we all know that IIH is a rare disorder characterized by increased intracranial pressure of unknown cause, but it is associated with SARS-CoV infection, which is described since the beginning of the pandemic. So in the cohort study of hospitalized severe COVID-19 patients, there are almost 45.5% of neurological complaints. So however, there is a still controversy surrounding the diagnostic criteria of IIH. So the main aim of our study is to evaluate the causes of papilledema in the young age group following COVID-19 infection or COVID-19 vaccination at Jimsa Teaching Hospital, Visakhapatnam. It is a cross-sectional case series. We have taken 84 young patients were screened in Ophthalmology Department, Jimsa, Visakhapatnam from the period of 2022 to May 2023, and patients were evaluated under the modified dance criteria. So here we have done the comprehensive assessments including ocular examination, visual field testing, and the brain imaging were done mainly in the diagnosis of the cause of the papilledema. So here the patients were treated symptomatic by the neurologist like isdazolamide and IV mannitol and anticoagulants, etc. So the inclusion criteria are patients who are above 15 years, and the patient had the previous history of COVID, post-COVID and post-COVID immunization within 6 months of period, and the patients who are used steroids during the COVID effect. So in our exclusion, we have excluded 15 years below 15 years patients, and patients already who had the previous history of coagulopathies, abnormal prothrombin factors, neurological diseases, and patients who are recovered from COVID-19 6 months beyond and post-COVID immunization beyond 6 months. So in our results, out of 84 patients, 18 patients are diagnosed as papilledema. Out of that, 12 are female and 6 were male. So in that, mainly 3 are obese, who are mostly of a female, and the mean age is 22.5 years, and 5 patients have the use of history of oral contraceptive use, and there is no history of steroid intake. So this is one of the patient's picture, which is showing the bilateral papilledema of elevated disc bilaterally, and which shows in the left side shows the hemorrhage. So here the another picture of the following patient, which has the symptomatic relief of and regression of papilledema within 4 to 6 weeks. So coming to our distribution of papilledema, out of 18 patients, IIH is seen in 11 patients, and cerebral venous sinus thrombosis in 4 patients, and meningitis in 3 patients. So this is the MRI scan which shows the subarachnoid space in the optic nerve sheet. And in our discussion, mainly in our study, IIH is seen in 11 patients, as I have told. The main hypothesis it may be due to increased intracranial venous pressure and venous outflow abnormalities, and there may be any intracranial vascular clotting. So cerebral venous sinus thrombosis is seen in 4 patients in our study, maybe due to it associated with coagulation dysfunction, and the main pathognomic mechanism can be increased levels of von Willebrand factor and systemic inflammation pro-coagulative state. So CSVT generally prevalence is higher in patients with COVID-19, reaching 0.02% to 1%, mainly in hospitalized COVID-19 patients. So in my conclusion and take-home message, the upsurge of IIH may suggest a potential association between the IIH and the related pandemic, and further studies etiopathogenesis in this age group are to be considered, and here therefore it is advisable to consult the latest medical literature and studies for the most up-to-date information on the connection between the IAH and the COVID-19. These are my references. Thank you.
Yeah, well documented and well presented. What is the type of COVID vaccine they have taken it? You have any idea about that? You noted down?
Yes, sir. I have taken, most of them have taken the shield, sir. COVID shield.
Covishield. Okay, so there is
Covishield.
another factor which is also questioned several times. I don't know the validity of it finally.
Yeah. So you want to ask which vaccine kind of thing? Yeah. So Covishield and AstraZeneca vaccines have reported to have more complications as per the report. The neurological complications are more commonly reported with them. How did you define the temporal association? Within what time of the COVID infection or COVID vaccination the patient should have developed?
In general, we have taken within 6 months period.
6 months is, don't you think it's a too big a period to pause? So during that time a person can have recovered and could have gone to develop.
Yes,
Also you noted 3 patients had meningitis. How was the presentation different in them?
Generally the correlation of idiopathogenesis is not known till now. The connections.
There is a proposed mechanism that either hyperfiltration
Hyperfiltration, it can be.
that leads to reduced venous flow. This is what is proposed. And meningitis is possibly not related to COVID.
Not related to COVID.
COVID-19. So those patients can be excluded from this study. Thank you.
So in your practice, you are seeing so much of surge, sir, in this IAH?
Not currently, but during the first and second wave, we did see a lot of patients. Neurological complications were quite common, and most common was stroke, followed by disc edema.
Okay.
Thank you.